Welcome everyone. This is just we're trying to do a little bit of a feedback of the book, Chakra's book, whatever you've read so far, and trying to get Sir's 2 minutes from him. Just if once he has spoken, if we could give feedback of what we have read so far. And there was a question that had come from someone in one of the groups. They had said that, okay, now I have the Chakras book, I have read it, how do I translate it into my practice, and when do I start seeing those changes in my practice upon what I'm applying of what I've learned. So we thought that it would be nice if we could get this answer for everyone so that we can put this part in IPEMA as well as ITC in the.
First of all, I don't think any ITC member must have asked this question because people who already see sense are attending.
Yes.
But what I would like to say is, what is chakra system? It gives you a holistic perception. First and foremost, it is a holistic perception. And in our first book, PEM foundation book, we have talked, no, zooming out, zooming in. So this dimension of case taking also is very important when you know the chakras and its perspective. So you also evolve, you start seeing things till you don't see that, don't develop your own perception that way, you're not going to be able to see. So one thing is that I see that you get a whole picture. Another thing is that it is holistic. So far, first we used to do only repertorization, which was very good for physicals, but we would get lost for the mental things. So then we developed something for the mentals where the maps were very helpful based on the individuation. Then many of you started telling, but it's also good for physical. But there's always a dilemma. Is it really or not? I think still our repertories are good. So this is the method which brings physical, mental, emotional, and spiritual together. So sometimes only from pathology, it's everything to do with urinary tract infection. Then I know which chakras to see. It also, when you talk to the person, what is his level of evolution? So I think it is very, very helpful. Hmm? But don't make it like, it's like a repertory. Now I'm using chakra 5, 6, this, and don't make it mechanical. See it see it from a broader perspective. See as a holistic thing. So when you see the person as a whole, then you know where you'll map him, you'll know what sort of remedies can come. So this information should not be exclusive. It is the last thing we have done so far. Hopefully it should be the last thing. So you have to add on to all the maps what we have done, our repertory, everything. Like just last MWM, I showed one case, where in the case I said that I got first through because of the repertory, I got this hint. And then it struck me. And then the whole picture came forward. So even if you are doing repertorization, you'll get some 7, 8 remedies. Something will pick up because of your whole idea of this method, what fits into the case. So in physicals, you may start with something very, all the modalities and sensation and location and everything, whatever you do, concomitants. But finally, when the remedies come, you'll know, or you'll say none of them. Now we are doing so many new remedies which you are never going to get in the book. For example, yesterday my son was saying, if I would have just come up from that that college and I would have practiced, none of the medicines we are giving today would have been ever there. In fact, most 90% what we give are the ones which we were never taught in our colleges. So all that, everything together you have to see. Don't see anything exclusively. Another thing what I want to tell you is how to apply it. Applying is a lot of art. So we have to go on seeing cases. As I was just telling you, that other day, that we have to come out now with some books where all the cases which have been solved, people can read through them. So it's like, I'll tell you that, I've read a book on how to do sculptures. So can I start making them? This is our own personal growth also. I think when we are doing ITC, we are growing every time. And this growth is like, I think Priya once you told us, it is like the tree. Every day you don't see the growth. But over 2, 3 years, you see, oh my God, this tree has become so big. Or your own child. Your child, so, you before you realize they've grown up. So this is very gradual. If you feel, I've attended 2 ITCs and I can see, you are developing yourself. So that is why I'm not just encouraging you by telling you all the time that, you all are very good. I really believe you are very good. Because if you come to my clinic, I think 90% of the cases you all will solve. This also brings me to another question. What sort of cases should I bring in ITC? Sometimes if I bring some, let's say, cases of one of those 90% ones, then after 1 or 2 turns, you all will say, अरे ये तो अभी आ गया, अभी अपने को इसमें कुछ नया सीखने को नहीं मिल रहा. So when you all are coming, you all also want to know something more, a little more twist, a little more twist. So that's why I'm little bringing. So sometimes because of that, you all may not get the remedy, but that doesn't mean you all don't know this method or it is too much. Sometimes you can become diffident. अरे क्या है? Last 3 turns I'm coming, I didn't get any remedy. But these are difficult cases I'm bringing. Behind every that difficult case, it's like, you're preparing for your IIT. Those coaching classes give you such difficult cases that when you teach maths, that when you really go for that exam, they are baby cases. You like it very much because when they write all types of sums, So most of the sums you'll be able to do. But those IITians always discourage you, make you feel you still don't know, you still don't know. They will give you tougher and tougher questions. I think probably Midda will agree with this, Prachi. So this is...
गांधी सॉरी, मैंने कोचिंग की ही नहीं थी, मेरा तो दिमाग खराब था. मेरे डैड फिजिक्स पढ़ाते थे, उनसे भी मना कर दिया था पढ़ने को.
तो सब खराब दिमाग वाले ही आते होम्योपैथी में. अच्छा बात है.
You had said when we had spoken that incremental changes are imperceptible, but they do occur, and then
And that's why I told you, like a tree, that incremental you don't realize. So I have always this dilemma. If I'll bring too easy, I'll say, अरे ये तो second case तो इतना baby था यार, उसमें कुछ सीखने नहीं मिला, ये तो किसको भी आ जाएगा. But किसको नहीं आएगा? All the remedies you all are giving, I'm telling you, even the topmost homeopath, India and abroad, will not give those remedies which you all are giving. Simple nepenthes and remedies like that. Oh my God, what you all are doing, you all don't know only very much. You all are very good, excellent. But it requires mastering. Homeopathy is not just science, it's science and art. So it's also a personal. So first of all, you should know, no? So chakra system is, first of all, this book is, it sounds a little egoistic, but I'm saying it's one of the most complete books. Some people have written only from a religious perspective. Some people, it is not, I have not found any one book which is a complete book, and with our whole understanding from the inner age perspective. So I think it's really monumental and very, very, very detailed. Even then, the book is double the size of other books. So please take it easy, read it slowly. And I think you have to use it for your own personal development also. And all these things, we are growing. So don't get discouraged. Even our ITC is becoming better and better, I think. Today is the 62. Number 62. How many cases we have done? Can you imagine? 62 means what? So you all are doing very good. When my children are sitting when I'm doing a case, sometimes when they tell the remedy, and then I tell something different, they say, this you can show in ITC. Because they feel, oh, there was a twist we didn't follow. Maybe they'll like it. So I personally bring something of that sort, or where I have also learned. So don't bother. I think you are all growing. So don't get discouraged. I'm sometimes worried. I have to strike that balance. If I become too much, it's like a coaching class. The teacher gives too many difficult sums, then he is worried that the children will get discouraged. He gives too easy, then they lose concentration. They say, I know. So how to balance is always a difficult job for me. But you all can tell me that we don't mind simple, then I'll bring one simple, one easy. One difficult. Yes, that was your thing, Bindu? Okay.
Yes, sir. If it can be like a 4:6 ratio or 3:7 ratio, because sir, like we have learned so many lycopodiums from you. I would not forget a case of magnesium that you had shown, sir. The perspective was mind-bogglingly simple. You could see that, but it was like so much like pulsatilla. But learning magnesium from that case, you said it is so simple, but that perspective to see it is very learn lot of learning, sir. So difficult remedies हमारे तो मेरे तो बस की अभी तक कुछ भी
Not
नहीं
remedies, not remedies.
as in
Remedies are
cases make
never difficult. It is coming to the remedy.
cases or coming up to that. So of course, so it can be a 3 7s, 4 6, whatever the others feel
And
okay with.
also focus another aspect which we are not understanding is which all need to focus is case taking. Yesterday, my daughter presented one case and then she was thinking, is it lac caninum, venum also possible and something. And when I took that case, I came to lupinum. And then she said, oh my God, there was something to learn. So how you take case is also important. This is also very important. So when you go on seeing the cases, when you're hearing the patients and how I'm talking and all, that is also learning. So a lot of things are happening. So if you want, it will be easier for me. Can you imagine for every 15 days, I'm bringing two little sort of difficult for me also to get so many cases from my practice. And I'm going on doing so far. God has been great, but it will be easier for me to bring one simpler case than one.
People like us, it will help a lot, sir, in learning. We're just starting on the path.
What starting on the path, Rama? You're from there in the beginning, okay? What do you say, Malak Bhai?
Anybody
Very,
has
very good
any
morning, sir.
feedback so far of, whatever they have read of the Chakras book also? It would be great if you could just take a couple of minutes and, tell us so that we can put it up.
Maybe people have just started reading, Malak is reading even on his holiday. उसके हफ्ते को बीवी छोड़ के चली जाने वाली है.
नहीं सर.
ट्रिप पे आता है तो भी किताब पढ़ रहा है तू.
नहीं वो तो फ्री टाइम पे पढ़ने का ना सर.
So, the other question is unrelated to the Chakra book, but it is because of the ITC case that we had not last time, the time before, where we had done one of a invertebrate and one of a vertebrate. So the question that had come was that you had said the main differentiation is with the power of introspection which a vertebrate has, that actually if you can see it in your patient, it is something subtle that you can pick up. But supposing we have invertebrate patients or invertebrate family member, somebody needing a person from our family needing an invertebrate remedy, what are the tools that we can use them to teach them or bring their awareness for this introspection so that we can manage them a little better?
First of all, you cannot do that.
Yeah.
Don't try to change anybody. You can't do it. We are so programmed, my God. Everything we do is so much programmed. And anybody who tries to advise are only enemies. Unless they come and talk, even in my clinic, I will never advise. Even if I can see it, I will not advise. Because it doesn't go well. The patient should come and tell, what should I do in this condition? Is there any other alternative? Most of us, and also we have so many defenses against ourselves. As soon as you tell, no, you little bit, don't you think there's some ego problem? What ego? No ego. She's always telling my wife, she doesn't know. If I'll show ego, then she will know what is ego. And all. It goes on in tangential. You can't talk like that. So there is no sense. You cannot advise and you cannot help them evolve. Let the remedy do. A point will come where they may either say, now I am happy. See, if there's an invertebrate, mostly what they'll say, now my headache is gone, my symptoms are gone, so I will terminate the treatment. Somebody more evolved will say, no, I'm getting better and better. I'm getting more insights. I would like to continue. So I think that we have to leave it on that. How much they can do. So this also, if I have an invertebrate, how to make him a more introspective. They will never be introspective. You have to accept that and help them gradually evolve. That is the best thing you can. So you have to see those qualities. No, this person is too much self-oriented. Then you'll see a lot of nervous system disturbances. Their level of functioning, how they think, what they think. You'll see lower chakra predominance. Not too much into spiritual. But that is nothing good or bad. It's like you will tell that how will I start teaching what is sign and cause to a child who is in first standard? First standard is not bad. Nothing is bad. It is how much you progress from your level and become better and you move on. Okay, so there is nothing up and down, something better than the other. So we don't have to be that way also judgmental. Arey, ye to bahut spiritual hai, ye to sirf material hai. Help them at that level and let their soul, their spirit decide how much they want to go. You should be very receptive and open to being helping them. Okay? So everybody don't have to take to that level.